Hello, this is Pastor Danny Webster here. We wanted to have a brief video to go over the importance of social distancing and the requirements and the reasons why we social distance as we resume our church services. As you are all aware, we will be going to one service at 10 a.m. starting this Sunday, and we have increased the seating in the gymnasium to 150 chairs, which are all still 6 feet or more apart. And we are very thankful to have here with us tonight Brother Ernie Stegall, who has his master's degree in healthcare administration, and also Sister Victoria Fennell, who has her doctorate. She has a PhD in nursing and has spent the majority of her career in healthcare compliance and education. And so with no further ado, I've asked Brother Ernie Stegall tonight to take the floor and to make a few comments, as well as Sister Fennell. Brother Ernie?
I'm going to take a few moments and review a few issues on what you should know about the COVID virus. And the information's been obtained from our CDC website. The coronavirus is an illness caused by a person, and it can be spread easily from person to person. The virus is new, and it's spread throughout the world. Symptoms can range from any mild symptoms, such as a fever and a cough, to more severe illnesses. How is the virus spread? It's spread from person to person. Maintaining a good 6 feet apart from one another will help decrease the opportunity of this disease to spread. You can be infected from respiratory droplets when an infected person coughs, sneezes, or even talks. You may be able to get it by touching a surface or an object that the virus is on, and then by touching your face, your nose, your eyes, your mouth. That's a common way this is transmitted. Protect yourselves and others from COVID. There is currently no vaccine to protect us at this point in time. Maybe sometime in the future they will have a vaccine ready for us, but at this point we don't. Stay at home as much as possible, but when you are out, making sure that you have that social distancing is most important. CDC still recommends that we wear a face mask. It can be a simple homemade cloth mask that you wear, or a surgical mask of medical grade as well. Clean and disinfect frequently high-touched areas. Wash your hands. That's one of the most important aspects of preventing any type of spread of disease, is making sure that you wash your hands. You can use a hand sanitizer that's an alcohol-based as well. We prevent this COVID spread by staying at home, especially if you're sick. Okay? Make sure that you get medical care and treatment. Avoid public transportation such as taxi cabs, buses, ride sharing. Separate yourselves from others and your pets at homes if you're sick. Know the risk for this severe illness. Everyone is at risk for COVID-19. Older adults and people of any age who have serious underlying conditions such as diabetes would be higher susceptible of getting this disease. These recommendations all have come from the CDC guidelines, and I thank you for your time today.
Thank you, Brother Ernie, for that information. And so, with that said, the question comes up, should we be gathering and having service? We do not want to do anything that's going to put anybody at risk, and that is why we have chosen to move our services into our church gymnasium that has approximately 10,000 square feet, and we're able to set out 150 chairs and maintain in excess of 6 feet between any one chair. And so when you come to service, we ask that if it's not your immediate family that you shelter with, that you do not slide your chair over and get close to someone just because they're a friend or a distant family member. It's important that we maintain our 6 foot distance at all times, even when we're praying in the altars or fellowshipping and speaking to one another, that we do not approach closer than 6 feet. And while many of our young people would not be at any severe risk, even though we can't guarantee this, it would pose a great risk to those members of our congregation that are elderly or sickly, as Brother Stegall talked about, So for the safety of those who are of advanced age and have a little bit of gray hair, such as myself, your parents or your grandparents, it's very important that we maintain our social distancing. So should we be gathering? The Bible says, forsake not the assembling of ourselves together. It's very important for the church to come together. And in the early stages of this, we followed the guidelines of the national CDC and our governor, but our governor has now allowed us to have gatherings with social distancing. So should we be gathering? I would say if we can keep the risk low and maintain the proper social distancing and wear a mask if necessary, I think that's a great idea. And I don't want anyone to feel out of place if they wear a mask. I think it's a great idea for us to do so. If we can maintain the proper guidelines and we are following the leadership of our state and our national CDC, I think it's okay if we gather, but it's very important that we maintain our strict social distancing protocol while gathering. I have asked Sister Fennel to come here today, and we are so grateful for her expertise in medical safety and compliance. And so we're going to ask her some questions and get her perspective. She has many, many, many years as a head nurse and working as a compliance officer, traveling around the country and counseling with various health organizations. And so we're thankful and honored to have her as a part of our church. So we want to turn to her at this time and get her response. And Sister Fennel, I would like to ask you your opinion and your expertise, if you would answer this question. How should we greet one another whenever we are in the house of the Lord? I mean, we're used to hugging, shaking hands, things of this nature. Should we greet one another in the usual fashion that we are used to?
The governor has indicated that it is permissible for us to gather and have in-person church meetings. But one of the things that we have to do is we have to maintain the strict social guidelines. So we recommend that people do not hug each other, shake hands, or touch another person, while they're in our services. And to keep a 6-foot distance, from people who do not live in their household. It's okay to smile and wave, but when you were in public, as you were indicating, if you don't think that you can maintain a 6-foot distance, then you should wear a face mask or a face cloth.
The next question I would like to go over is our seating arrangements. And as I said, we have spread our chairs out, but it's common for people to want to be close and slide their chairs closer together. I'd like for Sister Fennel to address this for us now. Sister Fennel?
When you're choosing a seat, make sure that you choose one so that you can maintain the 6-foot physical distance in the front, in the back, to the right, to the left. We even have a song that talks about, that God protects us, in all those different directions. Well, he's asking us to also use wisdom and make sure that we maintain that distance at all times. And I just want to point out that this applies to everyone in the church. It applies to the congregation, it applies to our praise singers, it applies to our musicians, and also to our greeters. Now, if you're with family, people who actually live in your household, it is permissible for you to sit closer, than the 6 feet, from them.
Thank you, Sister Fennel. I want to ask you, what is your advice to our elderly people, or people with special health care considerations, people who are in high-risk populations, caregiver, or anyone who might be ill? I would like to get your take on this and see what your opinion would be and your advice would be to the congregation.
Well, first of all, if anyone is not feeling well, then we encourage them to stay at home. Certainly call in, for prayer, but if you're not feeling well, you really need to stay at home. There's a risk that you could spread an infection to others, so we ask that you respectfully stay at home. Also, you can join us on our webpage, on live stream, and on Facebook Live for any of the services that we have. We don't want anyone to feel like they're under any type of pressure to come to the in-person services. So we just want to have the opportunity to enjoy each other's presence and the presence of God, you know, as a church body.
I want to thank Brother Stegall and Sister Fennel, first of all, for coming in and giving their time to answer these questions and share this information with us. And also, if we all work together, we can safely hold services, you know, in the church, and hopefully this will pass soon. We're looking at, you know, ways for us to move into our sanctuary. But I personally feel, even as the state opens and, you know, people begin to move about in the community, what we don't want to be responsible for is for a pocket of infection or transmission to take place within our own church because we were not careful. And we need to look out for one another because truly we are our brother or sister's keeper. And to our elderly saints who have been so faithful and have supported this church for years, we want to thank you, and we want you to know that we are praying for you and we are here for you. But do not put yourself at risk in order to feel like you have to attend service to prove your faithfulness to the church. You have proven that for years and years and years. And also to our young people, we know that, you know, you are excited to see one another, and we know how important it is for our young people to have fellowship. But for the sake of us and your friends and your own family, I ask that you would please listen to all of these guidelines and follow these guidelines so that we can all be safe as we fellowship and worship God together until this too shall pass. Thank you for your time. God bless.